Next is to differentiate sterile technique from clean technique. For sterile technique, sterile can be defined as generally meaning free from microorganisms, and as such, it involves strategies used in patient care to reduce exposure to microorganisms and maintain objects and areas free from microorganisms as much as possible. It involves meticulous hand washing, use of a sterile field, use of sterile gloves for application of a sterile dressing, and use of sterile instruments. Sterile to sterile is applied, which involves the use of only sterile instruments and materials in dressing change procedures, and avoiding contact between sterile instruments or materials and any non-sterile surface or products. Considered most appropriate in acute care hospital settings, for patients at high risk for infection, and for certain procedures such as sharp instrumental wound debridement. Clean technique. Clean means free of dirt, marks, or stains, but not necessarily free from microbes. It involves, hence, strategies used in patient care to reduce the overall number of microorganisms or to prevent or reduce the risk of transmission of microorganisms from one person to another or from one place to another. It involves meticulous hand washing also, maintaining a clean environment by preparing a clean field, using clean gloves and sterile instruments, and preventing direct contamination of materials and supplies. No sterile to sterile rules apply. This technique may also be referred to as non-sterile. Most appropriate for long-term care, home care, and some clinic settings, for patients who are not at high risk for infection, and for patients receiving routine dressings for chronic wounds such as venous ulcers or wounds healing by secondary intention with granulation tissue.